The lowest risk anticipated labor can suddenly turn extreme high risk. There's many things that can happen that require emergent services. And since the OB hospitalists have been here, I know personally I've had at least 5 women that I could not get there in time to get the outcome we got.
OB Hospitalist Group and the OB Hospitalist Program is a program where physicians are available in-house 24 hours a day, 7 days a week.
I think the community can feel safer knowing that they can get that immediate care, that there won't be a delay in the care.
We had angels here at Halifax, and everything came into play by having the doctor here, by making quick decisions, because the doctor told me after the surgery that when I brought Eileen here, she was already dying.
We didn't have hours, we didn't have a half an hour, we had minutes to make decisions. So from a doctor to drive from home to come in really meant life and death for this young woman.
Because when Edna got here, she was actually in shock, and she had been bleeding into her abdominal cavity through a hole in her womb. And the nurses immediately realized what had happened. Dr. Watson immediately realized what had happened.
Her blood pressure was low, her heart rate was elevated, and the baby's heart rate was low. At that particular time, we stabilized the patient with IV fluids and immediately rushed her to the operating room for an emergency cesarean section.
We had the NICU team there in the operating room. We had 2 NICU nurses that were there immediately to help resuscitate the baby. The fact that all of our labor nurses are also trained to help take care of the baby gave even extra hands to help resuscitate the baby, and the baby got excellent care from the second she was born.
I am absolutely convinced, had not Dr. Watson been here, had we not had our relationship with the OB Hospitalist Group, well, I know we would have lost that beautiful baby, but I'm not sure we would have even been able to save Edna.
I'm so grateful that you guys were there. God put the right people at the right time, and you guys were there to help us. If not, we wouldn't be here.
We wouldn't be here giving this testimony.
Having that team of experts ready to go, just in seconds ready to go, is the difference between life or death. And we have that right here, under one roof, right here in Daytona Beach.
There are no words to describe the satisfaction that, that I as a physician have when I see a healthy baby, a happy mother, and a happy father. And that is what we are about in terms of improving the quality of care here at Halifax. It's indescribable.
I think the world of everybody here and how they treated us, how they support us, and how everybody was a team, and everything just fell into place. And I was glad. I was happy, and I thank God that everybody was here at the right time. And so I thank God. I thank God that this hospital is prepared.